Hey, Dr. Shoshany here. Health insurance in America today, quadrupling the prices of medication. There's no accountability, $4,000 to $6,000 deductibles, just because they can. The system that is broken. So who's winning here? It's definitely not the patient. It's definitely not the provider. Guess who's paying for it? You are. Broadway in Soho, Manhattan. So come on in. Hey, Dr. Shoshany here. I'm doing a short video on the state of health care or health insurance in America today. The reason I decided to do this video today is because last night on Netflix I watched a new documentary that I recommend everyone watch. It's called Dirty Money, and they followed this pharmaceutical company and how they grew and grew and grew, and what they did is instead of research and development, they were buying up companies and quadrupling the prices of medication that people needed. There's a reason our insurance sucks. It's companies like this that gouge insurance companies and no one goes to jail. There's no accountability. Just today, we had several patients call in our office, wanted to be seen, and they have deductibles, $4,000 to $6,000 deductibles. If you're not sure what a deductible is, a deductible is what you have to take out of your pocket before the insurance company reimburses the provider. Been in practice 20 years. People used to have a deductible of $300 to $500. Now we're seeing $5,000 to $6,000. And the kicker is the premiums, what you're paying has doubled and tripled, and every year they double and triple. So it's a system that is broken. I don't know if there's a solution any time in the future, but what we're noticing as a provider, as a chiropractor, we're getting reimbursed less. As a person that has health insurance, my premium has doubled, my deductibles have tripled, and I am no longer able to use the insurance when I go to the doctor. So everything is out of pocket, and patients are having to pay more out of pocket. They're less likely to get the care they need because of their $50 to $75 co-payments. So who's winning here? It's definitely not the patient. It's definitely not the provider, because as a provider, I can attest to that. My expenses have definitely gotten higher, my reimbursements have gotten lower, and patients are having to pay more out of pocket. They're less likely to get the care they need because of their $50 to $75 co-payments. So the reason I did this video is, what's the solution? Let's have a discussion, comment below. I'm happy to entertain the idea of what other solutions are. So give an example here. There's a very rare disease. It's called Wilson's disease. It's your body's inability to process copper. And without this pill, you'll go into kidney failure and die in days. It used to be $1 a day. It's not, it's an old drug. This company, Valiant, bought this company that made these pills and raised it to over $2,000 a pill. Last year we had it with Martin Shkreli, can't even pronounce the guy's name, the guy that bought the Wu-Tang album. He raised prices of a drug. We had the same thing with people that have anaphylactic shock. When they go into shock, they need a shot of ephedrine. That went up through the roof. So drug prices are getting raised, and guess who's paying for it? You are. Your premiums are doubling. Guess who's paying for it? I am, because they're paying me less. So we're all paying for it. So in the end result of all this, what happens from the provider end? Well, in the provider end, if we're getting reimbursed less, we're spending less money in continuing education. We're having to see more patients over a shorter period of time, so almost having to rush the care, which is something we don't want to do. So that's why I don't work for an insurance company. I work for patients. I want to spend quality time providing the services that I know how to do best to get my patients fully functional and back to their daily activity without drugs and without surgery. But in the real world, people have to churn and burn and get people in and out of their office just to pay the rent. So what happens is quality of care goes down, expenses go up. This is not a real solution for healthcare in America today. So how this all boils into the opioid epidemic: providers that prescribe, physician's assistant, nurse practitioners, your medical doctor, you go to him, you only have 10 minutes and you're complaining of neck pain or back pain or whatever pain you have, he's almost forced to provide you with a prescription of a dangerous and powerful narcotic or muscle relaxer that definitely not going to fix the problem. It may provide temporary relief, but it doesn't address the underlying cause of the problem. Even doctors that don't want to prescribe, they're just forced into this vicious cycle of having to see a lot of patients in a short period of time, and all the education they're receiving is from drug reps. I mean, just recently, I think last week in CNBC, they were talking about these drug companies will stop promoting their drug medications via the pharma reps to doctors. So doctors, all they know is prescriptions and medications. That's why In my opinion, in my humble opinion, chiropractic care should be the front line for people that are dealing with back and neck issues, extremity pain, shoulder. Chiropractors can evaluate them, treat them with hands-on care, refer them to a physical therapist. A lot of chiropractors work hand in hand with a physical therapist and an acupuncturist, and most states, chiropractors could do those work on their own. So we spend hands-on, one-on-one time with patients without drugs, without surgery, working with the power of their body to heal from the inside. It's not a quick fix, it's a long-term solution. And what's crazy is insurance companies would rather pay thousands of dollars for addictive pain pills than pay for a chiropractic visit, which has been clinically proven to get people back to work, back to living their life, cheaper, less expensive. I don't want to use the word cheap, but less expensive than if they were to see a medical doctor or get prescriptions and lose days at work. So the whole reason I'm doing this video is because this system is broken. It's exponentially getting worse with providers getting cut out, consumers and patients getting squeezed. Who's going to fix it? The insurance companies are not going to fix it. Your government's not going to fix it. The drug companies are certainly not going to fix it. Who's it going to be up to? It's going to be you, the patient, the consumer. You have to decide and get educated with what the best option is. Do your research. Instead of taking pills to cover up symptoms, find a chiropractor that'll look for the underlying root cause of the problem. Find a physical therapist to see if there's a muscular imbalance. Maybe put your money to seeing both of those providers at one time. So as I continue to put out videos, I want anyone out there to comment or share. I'm looking to get your story about what's going on with the state of healthcare in your family, in your home, and what we could do about it, because individually, when we get together, we could really make a difference. We're just silent voices, but when we team up and we share that information and calling the insurance companies out or calling out the drug companies, we can make an impact. Until next time, signing off for now.